Good evening, everybody. Can I give it just a second here for people to start coming into the room before we get started? All right, well, welcome everybody. This is our last One Health seminar of the semester. For those of you who have been with us through the entire semester, thank you so much. And I imagine there are some of you here that have been with us for maybe years now. Well, I'm going to kind of beat the horse here and tell you a little bit more about One Health. And again, One Health at Delval is very, very broad. Essentially, what we're looking at is, well, we had a speaker many years ago named Val Beasley. And Val said, there's one planet, there's one future, that's One Health. And I fully agree with that. You know, we've only got one planet here. We're all on this same piece of Earth, and we need to share it with the rest of life that exists here as well. And One Health is really a transdisciplinary systems approach, looking at the world as really being an entire system that we are a part of. We are not separated from it. And I think the other big message that comes with One Health is that none of us are smart enough to deal with the problems that we face. That any one discipline may bring a great deal of knowledge and expertise to a problem, but it really takes multiple disciplines coming together. And I think for you students, if you can recognize that just because you are majoring in a particular topic, that you should be involved with other topics and listen to what other points of view may be on a particular topic. And that's why at Delval, what we've been doing is trying to introduce One Health, not just to those folks who are either involved with human health or with the environment or with animals. We're trying to bring this to everybody. Certainly business has its impacts upon the earth, and the earth in turn, in the environment and animals and plants, have impacts on economics. And so pulling this all together, we attempt with these seminars to really bring a variety of topics to you and to enjoy learning something new that maybe we've never heard before and have a chance to bring those into our lives. Here at Delval, we try to do that in a variety of ways. Education is one. We introduce it to our first year students in Delval 2. Delval Walden students are encouraged to attend some of these seminars to kind of get them opened up to the idea. Many classes, particularly mine, beat the One Health horse pretty heavily. We really, I talked to my students, I said, what is One Health about? It's about everything. And everything is involved with One Health. We've got to pay attention to all of the aspects of this ecological system that we're living in. We'd like to encourage more students to get involved with research that's One Health related, doing projects across disciplines and involving different points of view. And then finally, outreach. And that's what these One Health seminars are all about, is outreach, not only to our students across all disciplines, but to the community as well. We encourage members of the community to participate in our One Health seminars. And we just had a One Health week a few weeks ago. Seems like a long time ago now, but it was only a couple of weeks ago. And again, there were activities that we hoped would bring people onto campus that maybe normally wouldn't be here. So at this point, I'm going to turn it over to our co-hosts for this evening. And Whittier from the Heritage Conservancy will tell you a little bit about the Heritage Conservancy and then introduce our incredible speaker for this evening.
All right, thank you, Reg. Yes, my name is Whittier. I'm here with Heritage Conservancy. We're one of the co-sponsors for this session. And a little bit about who we are. We are a land trust in Bucks County. So our initially the founders looked around and started seeing that Philadelphia was expanding pretty rapidly, and the land that's surrounding the area is getting developed pretty fast. So we have been preserving the land in and around Bucks County, farmland and forested land, and also historical buildings as well. And more recently, we're going into communities and doing educational outreach. And I have a QR code linked. So if you're interested in seeing what we're doing and how you'd like to contribute and see, we sometimes do some programming, please reach out. Always looking to make those connections to different organizations and to students, and to try and keep our planet healthy. So with that, let me introduce our speaker, Dr. Catherine Machalaba. Is a planetary health specialist at the Nature Conservancy. Her international research and policy work focuses on the intersection of health, biodiversity, and climate, and One Health strategies to reduce disease risks. She was a lead author of the World Bank One Health Operational Framework, published in 2018, to assist countries and donor institutions in implementing One Health approaches. Dr. Machalaba is a member of the One Health High-Level Expert Panel, formed in 2021 to advise the FAO, UNEP, WHO, and WOAH in their collaborative work, and previously served as program officer for the IUCN Wildlife Health Specialist Group for 10 years. She holds a degree in biology and public health and a PhD in environmental and planetary health sciences. Her doctoral work focused on the One Health economics of Rift Valley fever in South Africa.
Hi, everyone. It's really an honor to be with you. Thank you so much. I'm just going to share a few slides. I'm a very visual person, so just bear with me that these are mostly pictures, but I really want to really paint the picture of the importance of conservation, climate, and communities really as they intersect, and how we can use a One Health lens to optimize outcomes for all three of these really important focal areas, and that's really key to resilience. So I have recently joined the Nature Conservancy, and I will be sharing some work from TNC, but also some previous work, including in West Africa, where I've really learned about the One Health approach, including with communities. So I'm excited to give you a little tour of the previous work and lessons learned. I just want to start out really with the importance of what we're seeing in terms of planetary crises. So we often hear about the triple planetary threat or triple planetary crisis, so climate change, biodiversity loss, and pollution. And we really also recognize that these are very interconnected. So we can look at it from many different lenses. And, you know, if we think about impacts to species, including humans, we're a species that's at risk. But if we really think of then about how species, endangered species, for example, are losing their habitat under climate change, these scenarios, and I hope you're all seeing my screen with the title "Connectedness of the Planetary Crises." If you're not, please let me know, and I'll make sure to change the setting. But you know, I think these projections are quite scary when we think about what's happening with this warming of the planet, and really what it means for species, including humans, but other species too. Then if we think about it, what it also means for ecosystems, this is just one example of coral reefs. So vanishing of coral reefs, we know this is tied to ocean warming, ocean acidification, and coral reef bleaching. But really thinking about the implications then for humans. So what happens with loss of species, the loss of ecosystem services they provide. These are really wide ranging. And if we think about something like coral reefs and the protection of our coastal areas, thinking about critical infrastructure, for example, housing, people who live in homes, hospitals that we rely on for essential services. Really this is very scary when we look at this, and then the implications for our own health as humans, what we see even just the burden today from these unhealthy environmental exposures, up to 24% of global deaths linked to the environment. And again, I should really highlight this is an unhealthy environment that's causing this impact to human health, and unfortunately it's growing. So things like air pollution, things like waterborne diseases, and many other impacts, which can really affect us across the lifespan. And of course, these exposures are changing under environmental changes, things like mental health concerns related to our changing environment, for example, but really wide-ranging impacts on our own health. So these are very interconnected, and I think, again, that's where a One Health approach is really crucial for understanding these links and also finding solutions together. Now, I'm not sure how many bat lovers we have on the webinar, but I certainly really appreciate bats for all the services they provide. And if you live in the Northeast, and now even we see the spread to other parts of the United States and even into Canada, and into Mexico, of white nose syndrome. So this is an invasive pathogen that was likely brought into the US probably by scientists like all of us who really love being outside, and in this case, someone going into a cave, likely with contaminated gear, bringing in a pathogen, white nose syndrome, the fungus that causes it, likely from a cave in Europe or Asia, where this is really an endemic pathogen that doesn't cause disease issues in bats. So there was an introduction, and it was really, unfortunately, very serious, and actually still very serious for the health of bat colonies, and some very significant declines in bat species, many bat species that are susceptible to this, but some that have really been quite impacted. And unfortunately, we see that the loss of bats has really important implications for agricultural production, and actually this is very valuable in terms of the ecosystem services that bats provide. There's been estimates of at least 3.7 billion per year from this pest control that bats provide just naturally as part of their day-to-day living. This free service that we get from bats that's so vital to our economies and to our agricultural systems. And unfortunately, because of the declines in these bat populations, we've seen that there's all this impact, this downstream impact, where you have the effects on insect-eating bats, and then this leads to interruptions in biological pest control. So bats are not eating as many pests, and then this is really increasing insecticide use. And it's so significant that actually a recent study linked this increased insecticide use, so these chemicals that are being used to control the pests now in agricultural systems, to impacts in infant health. So actually infant mortality, some associations really leading to an increase in almost 8% in some counties in the US. So very significant when we think about these connections between what's happening in other species and then our own health and economies. So these are not always apparent on the surface, these connections, but I think we really have to make noise about how important these connections really are, what they mean for our economies, what they mean for our health, and how we can really get ahead of these, early on and reduce the risk and certainly reduce the impacts. So this brings us to a One Health approach. And I know you're all very familiar with a One Health approach. I just want to highlight this very inclusive definition that we developed through the One Health high-level expert panel. This was a panel that was formed in 2021. Really to advise these 4 intergovernmental agencies. And you can see here the FAO, the UN Environment Program, the World Health Organization, and the World Organization for Animal Health. So these are the big agencies responsible for food and agriculture, for environment, for human health, and for animal health, including both domestic and wild animal health. So really having this harmonized definition that has been endorsed by these 4 agencies, I think it's very important for guiding how we work together, for guiding what we're working toward, and really understanding how each of the pieces fit together. So you can see in this definition, it includes the health of humans, domestic and wild animals, plants, and the wider environment. It also focuses on multiple sectors, disciplines, and communities at really varying levels of society. So if we think about really at the community level, but also then the interaction with local, national, regional, and global. And then really thinking about the different threats that we face and sustainable development at the core. And, I think the really interesting part of this is these key ingredients in the center. So these 4 C's: communication, collaboration, coordination, and capacity strengthening. So things that we really do every day. I think we embrace these already. We use them as tools in our work, but we have to make them more routine, and we have to make sure that they're really guiding work and decision making day to day, and that communities are informed really at all levels to make the decisions by considering the different co-benefits and trade-offs. And I think that's really core, again, using these key tools to guide our work towards healthy ecosystems, healthy animals, and healthy people. So these trade-offs and co-benefits, I think it becomes really clear at the community level when we look at specific contexts, specific issues and priorities, and also stakeholders. But I think these definition principles are very helpful. So as we developed that very inclusive definition, we also said, what needs to be behind it that really is anchoring it, that's reminding us of how to work together. So these components like equity between sectors and disciplines, think in the past we have seen that sometimes the environment sector is not always really equally represented. There are some different reasons for that. I think resourcing, sometimes capacity, but also sometimes just not really seeing how it's relevant. So again, if you're working in conservation, I think we have a real role to play in making some noise and making sure that people are always aware that there is a role for environment, for example. And I would say if there are other sectors that you're working in, don't be shy in making the case and saying, look, I think this is really important for this decision making, and here's why. And then socio-political and multicultural parity, so really equal rights and opportunities, thinking about being very inclusive and engaging communities and marginalized voices. We need to make sure that the solutions really work for everyone, that we're thinking about, environmental justice and health justice, and that inclusion piece is really key. And then socio-ecological equilibrium. So really looking at these interactions, the intrinsic value of living things within the ecosystem, the importance of biodiversity, and really thinking about sufficient natural space and resources. And then that links very closely then to the next principle of stewardship and really the responsibility we have both for populations today, but into the future. So there's well-being of current and future generations. And this also relates then to the importance of welfare, both human and animal welfare, and really the integrity of the whole ecosystem. And then finally, there's so much we can learn, certainly from traditional knowledge forms, modern knowledge forms, bringing those together, making sure we're really understanding. And this is very transformative when we think about these principles. There's a lot to learn and how we bring this into some context. If we think about health systems, this is not really how we work day to day, but it is quite important. And there's a lot of inspiration too from community levels where this is more, I think, integrated in the way that Indigenous communities and in some cases local communities are really working together to embrace the connection with the natural environment. So I always look at these, keep these in mind and really think about how we can do things differently and better to have these more equitable outcomes. Now, going just back to the global level, when we think about, what is being prioritized right now, there is a One Health Joint Plan of Action also developed by these 4 partner agencies called the Quadripartite. So they've really committed to working together, and they have identified 6 action tracks for priorities. And then this is helping to inform work at the regional level and at the country level, including with One Health plans of actions and strategies. So you can see here, there's several different topics. So overall capacity, reducing risks from emerging diseases, including zoonotic epidemics and pandemics, thinking about zoonotic, neglected, vector-borne diseases, then food safety, antimicrobial resistance, and then this very broad area, Action Track 6, of integrating the environment into One Health. So I'll be talking more about this one in particular, this environmental lens, really from the conservation focus, but really how it serves health outcomes and how we need to be thinking about communities in that and really empowering communities to take a role for their own health and really the ecosystems that they're living in and around. We know really at the global level, but then at the local level, these day-to-day services that are really underpinning our health and well-being. There are many. We're not very good at quantifying them, I would say, as a One Health community globally and locally. And as a result, we sometimes miss really these trade-offs when we do change our ecosystem. So impacts on freshwater, for example, if we change our use of watersheds, if we really pollute our waterways, we know these have impacts on health. Sometimes they're very far downstream, and we're not really taking a One Health approach in how we plan our water usage and protection of natural water sources. And I think, there's an economic component. We often realize this really too late. So thinking about how do we move upstream? How do we really be proactive in our decision making? There are some very good examples of that, but they're unfortunately few and far between. So if we think about these nature-based solutions for health, we can really change how we live, how we protect our ecosystems, how we invest in those natural systems and maintain those ecosystem services that really contribute to our health and well-being in very significant ways. Now, I just want to give a few examples from some work in West Africa, because I have learned quite a bit from our colleagues and friends and community members in West Africa. And so I just want to show a little bit in terms of really tangible ways that One Health is being implemented, what we've learned along the way from those case studies. So just some key themes that will really come out here. One is, of course, empowering communities and industries, whether it's a very official industry, something like the commercial mining sector, whether it's something like hunters, small scale miners. So really, making sure that they're empowered to make the decisions for their communities, for their colleagues, for themselves, to protect ecosystems and reduce risk, both to human and animal health. Broadening the One Health workforce. I think everyone being on the call today, you are likely coming from many different sectors, and really thinking about how we all can play a role and get others involved too in those One Health solutions. The context piece, I don't think it can be said enough how important it is. It also really allows for the design of some very creative solutions. And I think we need many solutions. So there are so many good initiatives happening. What I want to really get across is that we need many more. We need to upscale them. And it's not just one thing that will really move the dial. It's many solutions working in concert, making sure that we have those enablers in place, and again, embracing that context and creativity. So I want to talk a little bit about biodiversity awareness and appreciation, especially in Liberia, where I've been very lucky to be part of the One Health system there. There's a lot of biodiversity in the country. It's one of the biodiversity hotspots, and it has some of the remaining forest area, the rainforest, tropical rainforest, very important for carbon sequestration, but very important for really protecting, maintaining endangered species. So you can see here for the protected animals of Liberia, there are many. Unfortunately, many of them are really under threat. So there have been some very exciting initiatives just to get the word out. So using, visual tools like murals so that people really have a sense of why these are important for their ecosystems, and also learning the laws. There may be a law at the national level, but to really translate that then down to the community level and the importance of it, so certainly the law itself, but then the enforcement of it, the change in norms, really important to be reinforcing that. And you can see here, I love this picture with the rangers really going out and doing this community level education about what the protected animals of Liberia are, and why people should care about it. I think we sometimes, forget or don't always build in the right resources to do this very intensive one-on-one community level outreach, but it's so important both in cities where wild animal products often really end up in terms of the end user demand, but certainly also at local communities where there's that pressure, for example, to hunt. So, making those connections about the importance and also then the implications for human health too. And I'll talk a little bit more about that. But to give the example of the Western chimpanzee, this is something that my colleagues at the Liberia Chimpanzee Rescue and Protection have been very focused on. So when they first started working on this topic in Liberia, they really recognized that chimpanzee populations were very significantly threatened. And I'll get to why this is quite important, but there was this challenge in terms of what to do about it, because if you confiscate chimpanzees that are in the wildlife trade for pets or potentially for ending up in as bushmeat, it's really hard in terms of the treatment and care. So, you can't just bring that chimpanzee back to the wild, especially if it's a baby. There's also disease risk if it's an adult who's been around populations, human populations. So there's a lot of consideration that goes into it, and it's very resource intensive. You need the right setting, you need the right care, you need the resources for really their long-term sustainability. Chimpanzees can live up to 60 years or more. So really thinking ahead, and unfortunately, there was no place to bring these chimpanzees if they were being confiscated. So unfortunately, the laws were not being enforced, which makes sense if you think about that capacity issue and the resourcing. So very important in terms of the trends and what was happening. And our colleagues really said, okay, what can we do about it? So they created a sanctuary so they could work with law enforcement, with the Forestry Development Authority, really provide a place for those confiscations, so the chimps would have a place to go and really a safe home with enough nutrition, with proper care. And at the same time, really use this as an opportunity to build capacity and really build a system of tackling wildlife crime with the relevant actors. So this is an initiative in progress. I think there are some very important successes. So the outreach about really the importance of not hunting chimpanzees, and if I just go back to the reason why, we know the genetic similarity with humans is a pathway then for disease transmission. It goes both ways. We can get chimpanzees sick, they can get us sick. But then really thinking about their role in the forest too, for healthy forests. So they play very important role in seed dispersal. So we want to keep them in the forest. You don't want them ending up, in the wildlife trade and being killed. So there's the disease risk. There's the risk to the long-term survival of the forest, healthy forests, and then the contribution to carbon sequestration. And then they're also an umbrella species. So if you protect chimpanzees, you really protect their habitat and everything else that lives in it. I think that's such an important concept of, how we focus our efforts and making sure we are thinking beyond a species, but also their habitat and long-term survival. So I think this is really exciting, this model. There's a lot of employees that have been hired through this sanctuary, and then also the law enforcement, the science behind it. And the way you can see the site here, the way that this sanctuary has been situated is on a very important coastal area. It's mangrove forest. It feeds out into to the coastal area. You can see it here. It's really where two rivers meet. And so if you think about all of those important ecosystem services from those mangroves, from those riverine and coastal ecosystems, really important to protect this area. And right now it is a proposed protected area, but it has not received formal protection status from the government. So by taking this on in the form of a long-term community lease, so really the buy-in, I think it's a 25-year lease, and quite a big area. So you already see that some of the encroachment that was happening for hunting, for logging, that's reduced already. And it's also a way to increase awareness in the local population. So those employees who are really serving critical roles are also then informing their neighbors, their families, and really creating that awareness about why chimpanzees need to be protected and how they fit into the overall forest. That crucial appreciation of chimpanzees and conserving their habitat, and then also the link to livelihoods. There's a lot of more plans for this site and this work, including really sustainable food sourcing. That's a major challenge in Liberia in terms of really a lot of food waste and not getting places that it could go because of challenging road conditions, for example. And then really thinking about conservation monitoring and veterinary care. So, again, it's better to have these chimps in the wild. That's the end goal, to really prevent chimps from going into the trade. But when they are being in the trade, making sure that the laws are being enforced and that awareness is being raised. So a long-term solution, working with an NGO and the government and communities. Then in terms of this tension that we see, I just want to come back to the day-to-day challenges that we have to keep in mind when we think about conservation. So I was just talking about the hunting, and there are many reasons why people may hunt. Again, there can be a demand from an urban setting or maybe an international setting. There can be limited awareness of the laws or why they're important. But if we think about something like mining, and this was a example of where we saw miners really moving into Sapo National Park a few years ago. Very concerning. Sapo National Park, I know Dr. Hoyt has done a lot of work there, and it's a very special place in terms of primary forest and ecosystem services, and being a home to very special species, pygmy hippo, chimpanzees, many others, many that we probably have not even found yet and discovered, in terms of scientific monitoring. So, I think the solutions here, there are laws, but they're not always clear. That's where we need that One Health consistency, that One Health working across agencies, so enforcement can really be very proactive. In this case, it's very important to really see what worked, and that was involving traditional leaders. And sometimes the government, law enforcement, is not always the best suited to really do what needs to be done and get people really understanding, appealing to their heart, not just their mind. And I think that we have to embrace these traditional governance systems, as well as really building up the government, law enforcement systems, and ideally promote this joint security that protects everyone. So I think that this is really an opportunity in terms of who is part of the One Health solutions. Are they really aware, so that we can prevent that encroachment into these protected areas ahead of time, so that people won't want to really pursue those areas, really prioritizing other areas for mining. And these are, again, these trade-offs and decisions that have to be made, and we need a One Health approach to really get there. And now, just one other example from Liberia, we were doing some One Health training in a community forest. So this is an area right along the buffer zone on a proposed protected area. So communities have stewardship of this. They can really do what they want in this forested area. And they're really encouraged to protect it, but also really, use what they need for forest resources and cultural heritage. So I think there's always this challenge about biodiversity threats, the hunting challenges, the mining challenges, and then the potential to convert that land for farming and logging. So these communities are really getting a lot of different demands, including from commercial interests, and they don't always have the full information to make decisions. And again, that's really where a One Health approach comes in terms of the awareness of what it means to chop down that forest, what the short-term benefits may be, but maybe what the long-term consequences, which are not so good, could be. Changes in soil, soil erosion, for example, and flooding, changes in water quality, and really all of those things that encourage a more sustainable livelihood. So conservation compatible investments. To get there, I think there's a lot of important things that go into the equation, such as land tenure considerations, so community rights and ownership, so they can really make those decisions and be stewards of the land, ideally long term, to really promote that that long-term value of those ecosystems for people and for other species and for ecosystem integrity. And then really sustainable livelihood access and financing. So things like village savings and loan associations, very important. There's often this awareness about financial literacy that needs to be built in, but really having that foundation of access to finance, which is not always something that we can take for granted, especially in very rural areas, and access to credit. And then also thinking about what something like ecotourism means. It may not be overnight. There could be great potential for ecotourism in these areas, but it could really take a long time for the community to see those benefits, if at all. So, making sure that the community is part of that really is seeing the benefits directly, is trained up to be guides, to be, really playing a key active role in preserving the forest areas and other ecosystems, and also benefiting directly from it. And then the collaboration with rangers. I think this was such an important lesson for me when we did this training, and we did some communication to village leaders. You can see us talking here about, what to do if you find a dead animal. People really are embracing the information that they receive, and that was so encouraging to me. But we also saw them, and this was in the dry season earlier this year, we saw them going to this creek and filling up their water bottle. So this very shallow creek did not look healthy. We tested the pH. It was not ideal. And I think that's really important. And people were having to make the decision of, do I drink this water, or do I drink this palm wine? And do I find another alternative? And the wells were not working as they should. So this was really a challenge in terms of day-to-day access to basic services. And I think we need a community development fund. We need multi-sectoral coordination. We need to work with the resources that we have, such as those rangers who are hearing about these challenges and really, need to have a way then to reach out to the water authority and say, look, we need some help fixing the wells, so that they, as the rangers, don't have to make the decision, do I take the money out of my pocket from my limited salary and really, contribute to the community. I think we need these sustainable models so that communities can be empowered to advocate for what they need, and again, have these trusted voices like rangers to bring this back to advocate for them as well. So again, the role of different workforces, I think we all have a role to play, and sometimes it is just really advocating for those community needs, which may not be obvious. Then building and maintaining awareness and trust. We have been really excited to see our Liberian colleagues really bringing information to the community in very unique ways. So there was a book produced, Living Safely with Bats. This was actually adapted to about, I think, 13 different languages and contexts. So in some cases, it was hibiscus flowers. In some cases, it was other types of fruit and plants. But really key advice about what to do if you find a dead bat, for example. Also thinking about why bats are so important for our ecosystems and for our health. Insect control, pollination services. And you can see people really showed up for this information. So these are some of our Liberian scientist team members who were, giving this essential information, and people of all ages were there and so interested. They really talked about, norms in their community. They really embraced it. They said this needs to be brought to our neighboring communities. And they even talked about things like, consumption of bats and really saying this is something we want to commit to not doing as a community, really protecting bats and protecting ourselves. So I think these dialogues are so important. People have a lot of questions. For example, someone said, well, we're sitting under this tree. Should we cut down the tree because we see bats roost in certain seasons? These are important considerations where, people also need to say, look, this is an important tree for protecting against erosion. This has, mango benefits in certain seasons, and those connections really making people aware about the environment around them and then how they intersect with it. And I think this was so exciting to see this and just the embracing of the information. So I mentioned about expanding the health protection workforce, but I think there's a lot of exciting opportunities, community animal health workers really playing a role. Sometimes a little bit of, cross training or additional training is needed, but we all have a key role to play in getting information out. And I think especially right now in terms of the importance of local action for climate and conservation and health, this will be really important that we all embrace whatever we can do to get information out, to communicate and really work together to have a common message. Now, in terms of some of the structures that we're seeing being used for One Health coordination, these One Health coordination platforms are something that I think is now a best practice at a national level and even now at a county level and a state level. So within the US, there's a national One Health framework that is just getting started. Other countries, I think, are a little more advanced. So Liberia, Bangladesh, Ghana, Uganda, just a few examples of where we're seeing these very exciting coordination platforms almost now for 10 years on. So seeing how they evolve and, really work together, something like rabies vaccination campaigns, for example, but then thinking day to day about that coordination. So information sharing, early warning systems, and just making that collaboration, coordination, communication, and capacity strengthening more routine. So I just want to point us to the structure that Liberia first developed. This has now evolved. So again, these are really living platforms that are continually, I think, expanding, meeting new needs where we see a One Health approach can make a difference, but really very practical in terms of how people are working together, getting into the habit of sharing information, whether it's weekly or monthly, and also thinking about, political will. So you can see here, the vice president was involved in one point. There was a One Health secretariat with focal points from different agencies. So you sort of know who to call if you have something of importance to another sector. So again, making this really routine. Now, I just want to mention in terms of the climate aspect, and I'll wrap up in just a moment. But, I think when we look at these platforms, we may see our sector represented or we may not. So if you just take something like climate action, climate services, how can they add value in One Health coordination? I think this is an area where we haven't always had really the climate information services at the table, but there are so many important areas when we really think about risks and impacts to human health, to animal health, from climate change, and all the ways that working together can be really beneficial. So, I think if you're working in a different sector, please, think about this and please do get involved, whether it's at the national or state or local level or globally. Early warning systems, I'll just briefly say there are some great tools which we see at the global level and more at the national level, where we can really start to predict out, maybe 6 to 9 months out, something like what, an El Nino system will mean for different areas, and how people may move with their animals, and how that may result in changes in disease risk and also change in natural resource use. So thinking about how do we pair these really important scientific advances with what's happening on the ground. And I think there's currently a gap there, but again, something that we can think about in terms of community preparedness and resilience. And then systems thinking, this is a really exciting area. I think those connections, if we're not taking a system lens, we can really miss out. And this is a very exciting new initiative launched by our UN partners, really looking at how do we reduce the risk of spillover through strengthening the environmental aspect of One Health. What's very notable about this, and you can go online and learn more, but really this scoping phase that's built in. So 6 countries have been selected for phase 1, and before even designing the project, there's a scoping phase where everyone comes to the table, really looks at the issues, understands them together, and then designs the project. This is not the norm in how we do, science. We often have a scientific question. We're really excited about exploring our hypothesis. And then we often see the context, we're not always aware of all of the pieces of the system. So this new way of working, I think it's very exciting. I look forward to seeing really how the program evolves and hopefully expands in terms of this approach. Then communication, I just want to highlight in terms of the ways we communicate and thinking about, publishing beyond where we typically present our research. This was a Frontiers for Young Minds publication we recently released, and you can see the young reviewers, so actually a class reviewed this, and they were pretty tough in their review, I have to say. I really was quite impressed with their reviews, and they gave us great feedback in terms of how to really frame the messages in terms of the connections between biodiversity and human health. So, please consider publishing in a journal that maybe you're not used to, or a magazine or another community, getting information out in a way that you wouldn't normally reach a certain subset of the community. Now, I just want to really, in 2 minutes, just briefly highlight what we're thinking about at the Nature Conservancy now. We have just started a planetary and human health initiative, and we really want to be thinking about the benefits to people from healthy ecosystems and have that built into conservation early on, so that we're seeing the impacts, the positive impacts of conservation on human health and other species. So TNC has very ambitious goals, and I think if you look across these, conservation, climate, and communities, they're really the anchors, and health can play a key role both in terms of what motivates us to conserve these very important landscapes and oceans, river systems, but also the benefits that people can gain from that, and how that relates then to our changing climate. So a little closer to home, just thinking about cities and really our urban connections. So this is an area that I have been so excited to really see how TNC is engaging. And just one example from Kentucky, so not too far away, the Green Heart Louisville project, which really took a clinical approach paired with conservation and climate action. So planted about 8,000 trees, looked at really what happened before and after, had a control group as well, and really looked at different markers. So there was one marker of inflammation, C-reactive protein, that was actually really, really important, the effect that was found when we think about then how it relates to risk of heart attack. And then just how people perceive this regreening. So you can see the highway here, the before and after, really a lot of trees, but then the tangible benefit to humans, in addition to the clinical benefit, the day-to-day, feeling like our backyard feels like a sanctuary. I think this is so striking in terms of how people perceive it. And maybe this is, in some cases, their first real interaction with nature. If they're not, from a place like Vermont or Liberia, in the rural areas, maybe that if they've always been living in a city, they haven't always had this connection to nature. So ways to really bring conservation, climate action, and health all together. I think it's so exciting. And you can learn more on the website, greenheartlouisville.com. So just to close, I think with One Health, context is the most important consideration, and often that really is what's happening at the local community level. But the ways we can use a One Health approach, it can be in planning, it can be in implementation, it certainly can be in evaluation in terms of seeing what went well, what also didn't go well, and that could be at a community level in terms of maybe adverse consequences if we think about the whole scope of sustainable development. But I think there's some really exciting reports too if you want to learn more. So the Nature-Based Solutions for Health report was just released at the Biodiversity COP, so COP16, this is online, Nature-Based Solutions for Health. And then later next month, the upcoming knowledge synthesis, which will include a health lens in terms of health, water, energy, nexus. And I encourage you to look that up when it comes out. So thank you so much for the opportunity, and I really look forward to the discussion.
Thank you, Catherine. Boy, great presentation. Boy, you covered a lot of ground. Let me see. We've got at least one question here from Anonymous. Can you please elaborate on the topic of infant mortality rates in insecticides? I have yet to hear much about that.
Yes, thank you so much. Yes, well, I think this was a really, I have to be honest, it was sort of a surprising study that was done, because there hasn't been much really on One Health approaches to chemical contamination. I think we have the ecotoxicology, awareness that there is a potential connection, but really quantifying the effects can be quite challenging. So, to look at something like the impacts on bats and then really link it then all the way to infant mortality. I think we have to be really looking at those causal pathways more routinely and seeing what are the long-term consequences. But if you think about the use of insecticide, really this often indiscriminate use, it could be going into waterways. So you think about contamination of waterways, and it can be really contaminating plants, which then are consumed by people. So really these different exposure routes, contamination of soils, and then contamination of people who are applying these pesticides and insecticides. So many potential exposure routes. I think that would be probably a phase 2 of the study. This was a study conducted by an environmental economist. And I think, again, the value of having different disciplines looking at these topics is making these links that we wouldn't maybe immediately see. There was a similar study, another study done by that same author. I'll put them both in the chat, but looking at vulture declines in Southern Asia and the impacts on sanitation, and very striking there too in terms of really the economic implications, the health implications. So I think sometimes there's a tendency to not want to put an economic value on human health, human lives, but at the same time, it's very important for making the case in terms of the need for action and the need to invest in really protection of health through ecosystem management.
Yeah, I think Catherine, with the ecosystem services component of bats, immediately with the arrival of white nose syndrome, we're very concerned about what's happening to the bat populations. But I'm thinking also, about mosquito-borne disease. And, with the reduction in bats to be feeding on mosquitoes, I always wondered if there was going to be a connection to outbreaks of maybe West Nile virus that could be related back to the loss of the bats as well. We've got some additional questions here. Oh, Anonymous has given us some more. Was there any pushback from the communities when trying to prevent bushmeat hunting or any other changes?
Yes, excellent question. Yeah, so what I would say is, well, there certainly was concern. And I think what we learned very quickly was that, this work was being done after the Ebola epidemic. So that was a very traumatic time in Liberia's history and in a lot of West Africa's history. And, people who are not known to a village showing up sometimes with coveralls, which were used in Ebola treatment centers, was very scary. And I think that was something that was learned very quickly about you can't do that. That's not the right way to go into a community. And it really took time. And I think, again, that's that trust building and the value of working with local partners. And sometimes there's this urgency of we need to get out and get the information and do the scientific studies, but it really takes that investment in community trust. And there are a lot of communities. So again, it's not that you or I or, one single person has to be known to every community, but you have to work with the right partners. And in some cases, that is the rangers. In some cases, that is the community animal health workers or community health workers. The village chiefs were really key to village elders, village chiefs. I think you follow their lead in terms of what your partners tell you in terms, we need to do community introductions. We need to do some sensitization. Some cases there are important rituals that you want to be observing, and it can take time. So I think that building that into to the time frame and the awareness of why this is important, and in some cases too, people they you know, there's food security issues. You can't just say hunting is bad, you know, and really balancing, okay, here's what you have to consider for your own health, your community's health, for the environmental lens, and certain species are less threatened, and it's very nuanced. You know, there's legal considerations. So I think there's that stigma, but there's also the day-to-day needs of populations. And so it's not something that there's a you know, one size fits all. And I think it really has to be tailored to the context. It has to be something over time and culturally appropriate. And I think what we also saw is, you know, what's acceptable to a community may not be, you know, what's realized right away. And I think that time to work together and figure out those solutions, again, it's an investment in time, but I think it's the only way to really get there.
Very community specific, isn't it?
Very community specific. Yeah.
Anonymous has another question, but Anonymous, I'm going to jump over to Madison and then we'll come back to you just to give somebody else a chance here. So I want to say that that was a great presentation. I want to refer back to your discussion about the 4 C's. As you discussed it, I thought of consistency as potentially another C, because without consistency, we see the progression, we make a few steps back. Do you think encouraging communities, as you mentioned before, would influence more consistent change for the climate?
Oh, I love that point. Yeah. I do. I mean, I think context, it changes quickly, you know, sometimes in terms of you know, the technologies that are available, the solutions that worked yesterday may not always be appropriate today. We may see, you know, again, the trade-offs may not be obvious right away. So I think things do have to be a little bit dynamic, but I think the consistency piece, yeah, it's so important in terms of, I think especially from a sectoral perspective, you know, you don't want your Ministry of Agriculture to be saying one thing, you don't want your Ministry of Health to be saying another. You know, communities really get confused. I think we saw that in the US with COVID-19, with some mixed messaging about what to do, and you know, it's very confusing. So that consistency of something like a One Health platform, having a unified message, reinforcing it, again, working with different constituencies in some times, you know, that can be very effective. If we think about extension services, you know, you want to work with who you know and trust, but you want the message to be really reinforced throughout the system. And somewhere we have seen, unfortunately, in many countries where there's always a challenge is on the role of wildlife. And, you know, wildlife can be really villainized sometimes in epidemic situations, and that's a big problem. And to me, that signals, you know, the Wildlife Authority is not really communicating with the Human Health Authority, and there's this gap in awareness, and often targeting the wrong species or really having long-term ecological consequences. So I love the consistency idea. I think that's very important, and you know, if we can have 5 C's, that's even better.
And I think that another component of this is also the human and wildlife conflict components, and making sure that everything is really kept in focus and balanced along with our broader global goals, maybe. So Anonymous says, amazing presentation. How do you decide what project to allocate funds to and assign personnel to when working with the Nature Conservancy, as well as outside the TNC in other countries? It is a difficult decision in the sense that you do not want to push off other issues.
Yeah, thank you. Well, I have just joined the Nature Conservancy about 38 days ago, so I am not the best authority, but I would say growing, you know, as an individual, not an official line of TNC. You know, I grew up with a TNC managed site in my hometown, and you know, I think the importance of that site, you know, I would go there for recreation. I would really go there to learn about nature, and having that long-term place that was open to the public. And not all conserved and you know, preserved areas are, but that specific one was. And you know, seeing those connections, and it was sort of in a way that you could really learn and interact, but not not like going to a class, it was a little bit on your own pace. I think there's that value of long-term stewardship. And I know that's a tradition of TNC as well as other partners. And I think that's something that, we conservation, you don't want to really be you want that consistency of how you do conservation. You want it to evolve over time too, and I think that's something that TNC is very very excited about, that evolving to do things that are more equitable, that really take into account the needs of local communities, and having that scientific based way of making decisions about where what priority landscapes are selected. But I think from the long-term stewardship side, that's something that I personally took away from sort of my familiarity with TNC from a young age.
Well, thank you, everybody, for attending this evening. I just wanted to point out to you again that Catherine has put that article, that research article concerning the increased mortality rates due to the loss of bats and the increased use of insecticides. Really interesting article. I think all of you would find it. So the link is in chat. Don't forget to grab it before we leave this evening. We are at 7 o'clock, so I think it's about time that we wrap up. I just wanted to put another plug for the Heritage Conservancy, because that is, again, locally an organization which is protecting lands and protecting historical heritage as well. And these are opportunities for us to act locally as well as acting nationally, and then moving on to the global stage. I think that we all have our favorite places. Sometimes that's your own backyard. But in any case, thinking about the big picture and how it all connects, I think we could all benefit from thinking broader and listening to others. Whittier, do you have anything you'd like to add?
Oh, thank you, Reg. Yes, and just want to say that there's things that you can do, with our organization. We're always happy that we have cleanups, we have other volunteer opportunities, but not, just us. There's plenty of things that you can do right here, right around you, and see what speaks to you, and see if you can donate your time and, make a difference. So thank you so much. But if we're the best nonprofit organization to volunteer for, that's a fact.
I'm not going to argue with that. We love TNC and we love Heritage Conservancy. So, Catherine, thank you for such a fabulous presentation. You have given us so many things to think about. I know I'll be talking to my wildlife management class about this presentation on Tuesday. And we can go off in all kinds of directions with this. And Catherine, I am really looking forward to us having a further conversation tomorrow.
Thank you so much.
Everybody, I hope you have a great evening. I think this has been a great thing to think about, and go into your evening and enjoy the rest of it. Thank you so much. And please join us in the spring for our One Health seminar series again. Good night.
Thank you, everyone. Thank you, Reg. Thank you, Whittier.
Good night. Thank you.
Thank you.